We want to improve the treatment that patients receive. The NHS do a fantastic job, but they can't survive without charity support. I don't think they ever will be able to, because there's always new pieces of equipment that come along that are needed, that there just aren't the funds available for them to buy them. So, you know, we hope to be, by doing what we do, that we're enabling them to progress on to better treatment for patients.
My name is Marco Maccario. I'm the lead clinician for cardiac anesthesia and the lead clinician for the cardiac intensive care. The charity did a lot of things for us. A lot of equipment came directly from them, and this is our latest one.
Today, the money raised by the Sussex Heart Charity has been used to buy the paperless monitoring document for the anaesthetist, which is state-of-the-art and modern treatment.
We are going to be probably the first unit in the country, first cardiac unit in the country to have this system in place. It's quite a big achievement.
It means better care. They have a safer operation and a safer sort of pathway right from seeing the surgeon to going to his rehabilitation afterwards.
My name's Anne Gibbons. I'm the matron for the Sussex Cardiac Centre, which involves both the cardiology side of the centre and the cardiac surgery side of the centre. Well, the Sussex Heart Charity has been an essential part of the Sussex Cardiac Centre really. Since the centre opened, the charity's been able to provide equipment, resources, all sorts of things that have helped our patients both locally and the tertiary patients that are coming to see us now that we've become a much wider and well-renowned centre. So it's been essential really, a part of the functioning of our lives.
I'm Duncan Selby. I'm the Chief Executive of Brighton and Sussex University Hospitals. I have to ensure that the hospital has everything that it needs in order to care for the various, I'd say hundreds of thousands of people that come through our doors every year, and to ensure that the staff are cared for as best as we can and they can do everything that's asked of them by the very many patients and their carers that come seeking help and assistance. Without the Sussex Heart Charity, the hospital would not be able to keep up with all the new technologies. It doesn't matter how much the NHS invests, it simply cannot keep up with the rate of change and the opportunities to do new things and cutting edge things, to introduce new technologies and innovations, and the result of research.
My name is Peter Howarth. I'm one of the doctors in the cardiology department, and I'm doing a PhD at the minute in Brighton, looking at how stents behave in different populations. Sussex Heart Charity supports my salary, which is agreed to fund for 3 years in collaboration with the European Union, who also fund some of my research here. And that's really helped me to make sure that I've got 3 years where I can concentrate on the research and hopefully get some results out within that time scale. Cardiology is actually a very fastly growing subject. It's a pretty new subject as well, and especially in interventional cardiology. And so we're learning new things all the time, and really to help people with angina, we're really pushing the boundaries here to try and develop some new insight into how we can best treat people with angina and hopefully make their lives a little better. Well, this is local research looking at the local population, and so the people in Sussex who are part of the study will hopefully benefit in the future as we learn new things that we can apply to the Sussex population. And the ease with which the Sussex Heart Charity supported us was fantastic in getting us started so quickly.
Without the charity, we would not be able to offer the range of treatments and interventions that we are able to do today.
The Sussex Heart Charity is very important to us because it's our charity. They support us in every need and they help us to provide a better quality of care.
I'm Stephanie Baker. I'm the Principal Cardiac Physiologist. I'm in charge of all the cardiac physiologists who do tests like pacemaker checks, echocardiograms, exercise tests, any test really that involves measurements to tell us what's happening to somebody's heart. It's important to have the Sussex Heart Charity because it's a way that both patients can show their gratitude for treatment they've received, and we can provide such things as extra training for our staff that would not be provided by the Trust.
It is an incredibly important part of the NHS, and without it we would not be able to do anything like as well as we do today.
The next piece of equipment we'll be buying is an OCT, which is a camera that goes into the coronary arteries, and it will produce better images of the inside of the arteries, enabling the doctors and surgeons to make a better diagnosis and decide on what the best treatment is for that particular patient.
Other things that the charity has done is funded posts for specialist surgeons who are not doctors, which is a new thing, and that has been something that's been going on this year.
Without the Sussex Heart Charity, we would purely be doing the job we do within the constraints of any NHS budgetary control. We are able, thanks to the Sussex Heart Charity, to use cutting-edge equipment and kit that would otherwise be unavailable to us. The harmonic scalpel is basically a form of ultrasound which is able to dissect out and cut through the fatty tissues and the surrounding tissues, and therefore free up the conduit without necessarily imparting the surrounding or collateral damage to the surrounding tissues. We now have 2 harmonic scalpels in the department, and they're not cheap. One of which was raised, the money was raised by a very big motorcycle event which is held annually called Brightona,